Hello everyone, Heart Warrior here. In this video, I'm bringing to you guys just a high-level summary of a different tests my cardiologist recommended for me. These tests are the ones they used to recommend the open heart surgery for me. This is just my attempt to share my story, so folks who are undergoing heart issues, may find it useful. Of course, this is not a medical advice. Tests will be different based on your doctor's assessment, your conditions, and area of the world you are residing in, depending on the medical facilities available for you. So please consult your doctor to see what you will need. So very first test was electrocardiogram, and I'm pretty sure most of folks are aware of it. What is ECG or EKG is? This is very non-invasive test, not that expensive, and was done at the doctor's office. They did it twice actually, one last year, and when I had a problem this year, they did it again. The last year they didn't find anything wrong with me in the EKG, but this year they did actually found something that pushed them to do more additional test. After ECG, they did a heart echo test. Heart echo test is a non-invasive test where they use ultrasound to see how your heart is, how heart valves and everything is. In my case, it all came out good, so there was nothing wrong. They found with this test. The cost of this test is a few $100 depending on your the insurance, but I think it's almost I will say 700 if I remember it correctly. Again, and it was also a pretty quick test. No discomfort or anything. The only discomfort I will say was a cold gel they put on your chest. Apart from that, everything was pretty smooth. After echo test, I was made to go through the heart stress test. This is a test where they make you run on a treadmill. You'll have to maintain the heart rate of I think 145 for about 5 minutes or so. So you have to push yourself over there on the treadmill. Um, they will monitor your heart during the time, so I think there is that part that you don't need to worry. But I felt like still it is a little bit dangerous if you have a heart issue, I guess. But doctors know better than me. As far as the time is concerned, it didn't took me more than an hour. Cost-wise, was I think close to 1,000. Again, it will depend on your insurance, as I said earlier. But for me, I could go through the test easily. As far as the results are concerned, there were some findings, but the doctors did not take any action on that notes from the results. Um, so I don't know why, but that was my case. The next one is a calcium score test. The calcium test that you have to, sleep under a machine and they just measure your calcification of your heart and arteries. I don't think the cardiologists really take this test, for determining your problems or not a problem. It's just an indicator that you are, having more calcification in arteries and heart compared to the other folks. Um, and I think sometimes it doesn't give a correct results because there might be a soft plaque that is not identified by this machine. But that's just my understanding. But this test was very cheap. It's $100, and my insurance didn't cover it. And so, my doctor was like, you can do it since it was just $100. So I don't know how much it costs everywhere, but that was pretty cheap for us. So when I kept complaining about my shortness and breath, they did send me to CT coronary angiogram test. This is a test where they will inject a dye into your arteries using IV fluid. It's not really invasive test, not really painful if you're okay with the needle because they will put IV. This test will determine whether your arteries have a blockage. In my case, it was not conclusive because I think the quality of the image, as far as the cost is concerned, it's almost 1,000 plus. The time was not that bad. I think it took me an hour or so, but I had to drive to another hospital outpatient department for this test. Um, it's not bad. as I was saying earlier, if you're okay with the needle, this test is fine. Also, the dye causes sometimes, pretty strong reaction in your body for a few seconds. It was not too long, and nurses over there already warned me that I will feel like I'm peeing in a pants, but it's just kind of a burning sensation. But apart from that, it was all fine. After CT coronary angiogram, they sent me for a cardiac catheterization. This is a test, it's an invasive test where they will get through your groin, neck, or arm. In my case, it was the arm. They will get into your arteries to simplify, with the camera and the wires to see if there is any blockage in your arteries. This is, as I was saying, invasive test. It takes around 3 hours. I had to go in a hospital setting for this. If they find a blockage and if they can put the balloon or a stent, they will do that. I think it's called angioplasty. In my case, they said they cannot do angioplasty on me. Um, so as far as timing is concerned, 2 3 hours cost, a few thousands at least, I will say. My bill was total with other hospital charges, so it was more than that. But of course, you'll need somebody to drive you to the hospital and take you back home. My arm was pretty hurting after this, so it's a big, mindful of that. So these are all the tests that were, done on me before they decided I need open heart surgery after this cardiac catheterization. So yeah, this is a list of all the tests. Hopefully, some of you going through this will find this useful, and hopefully that's kind of it takes some of the anxiety out of the process that you might be going through.